What's going on, everybody? Welcome into another episode of the Strength for Your Purpose podcast. Dr. Phil Finemore here. So happy to be with you all back here again on this glorious Wednesday. I hope it's glorious wherever you are listening or watching here in YouTube land. Either way, thank you so much. Really hope you all have been enjoying the interviews. We have pretty steady interviews through the month of January, and they have been incredible. Some great information. Sometimes I wonder, like, well, we've kind of covered this before, and we've gone over these things before with different guests, but I think it's really great, and it's impactful for you all listening, watching, to hear some of the same type of concepts over and over again, but applied in different ways, because that's really how I think we learn them. So I hope you all have gotten enjoyment out of that. If you haven't, if you're a first time listener or watcher here, make sure you go back and check out those recent interviews. Really, really pumped to finally, I don't know why this took me this long, or us this long, but it did. Finally got Dr. Lauren, who is a member of my team with WorkFitME Mobile PT, on the podcast last week, and she talked about what she's passionate about, what she's excited to bring to WorkFitME Mobile PT here in the greater Portland, Maine area. And how she just loves to help people. So go check that out. That was a fantastic episode. But today, I wanted to talk about something that's a very popular topic, and that's back pain. And this is something that I'm very passionate about. And I think I'm going to turn this into a little bit of a series. It might not be like week after week, because I got a bunch of interviews lined up here through February all the way into March. So this is not going to be a week by week thing, but we're going to have different installments of this, I think. And today I just want to give an overview, just debunking a few things about approaches to back pain. So there are three things I want to cover today. Number one, and we're going to dive deeper on these as we go, but number one is no two episodes of back pain are necessarily alike. Okay. We have to approach it like they're different. Number two, no two episodes of back pain can be treated the same. Okay. Even if they are alike. And again, we'll get into this. And number three, early intervention in back pain is key to prevent it from recurring. But treatment for chronic back pain without medication, without injections, without surgery is 100% possible. And I'm going to talk more about that too. So again, no two episodes of back pain are necessarily alike. No two episodes of back pain can be treated the same. And early intervention is key, but chronic back pain is very treatable with conservative approaches too. So let's get into this. No two episodes of back pain are necessarily alike. Why is that? Really, this is because there are a lot of different anatomical structures in the spine that can irritate nerves and cause pain. So pain is our nervous system telling us something is wrong. Okay, we know that. And in the spine, that's the area that all of our nerves come from, right? Our spinal cord is in our spine. All the nerves that go out to every area of our body come out of that spine. So there are tons of nerves there. So they get a lot of information. And because there are all these different nerves going all these different places from all of these different areas in the spine, there are many different structures in the spine that, depending on what's going on with those structures, can then irritate the nerves locally there and cause pain locally in the back, as well as pain that radiates outward into the body. Most commonly, sciatica. I've got an episode on sciatica here. Please go back and look at that. Kind of search through the episode archives here. You can look at that. But sciatica is a nerve irritation that's ultimately coming from the spine most of the time. Irritation of the nerves in the spine. So why are no two alike? Simply because we have, and these are the most common reasons that we have back pain. These might not be the only reasons, but these are the most common reasons that I identify and help people treat. We have discs in our back, the discs in between the vertebra that can protrude out or herniate out and push on the nerves. We have joints in the spine that can cause pain. And we have muscle that could be in spasm that can change how the spine moves and change the stress placed on the nerves and cause pain as well. Those are the biggies. You can have fractures and things like hypermobilities where the vertebrae are kind of slipping forward on the vertebra above and below them. Those aren't as common, but those are possible too. So because they are three different three main areas that, or three main structures that can cause pain in the spine. That means that we could have pain at the same area of our spine and maybe even the same area in our leg, or if it's in our neck, that pain will travel down our arm and it can show up the same way, but not be from the same root cause. And we have to, I'm going to say this again, we have to figure out the true root cause of that before we can effectively treat it. Okay. And the best way to do that is not necessarily through imaging. Imaging has its place in the spine. We need that. That's probably a subset of our episodes. All of this is probably a subset of our episodes for this series on back pain that we'll do kind of throughout the year here. But imaging is sometimes needed, but it's not always necessary, because there can be a lot of things that show up on images that show up on images like MRIs and X-rays of people who have no back pain at all. In fact, that's incredibly common. Anyways, I digress. Because there are so many structures that could be irritating nerves in different ways, but could show up the same way, that means no two episodes are always alike. Also, it could be from the same cause, right? The same structure could be causing pain there, but it could be irritating a different part of the nerve, or it could be more or less severe than the last time. So it's almost never exactly alike. Okay. Even if you're feeling the same type of pain, it might respond differently. Okay. So in order to effectively approach this and effectively treat this conservatively, we have to act like no two episodes of back pain are alike. Number two, no two episodes of back pain can be treated the same. Okay. And that's because of number one. Again, even if it's the exact same structure, and we know that, okay, we know it's the same anatomical structure in our spine, excuse me, that is causing the pain, it may respond differently to our treatment. Okay. It might be more irritated than before, less irritated than before, the nerve, I mean. It might need some more aggressive treatment. It might need more hands-on. It might need more exercise this time. It could always be different. The reason that came back for you, the reason it's irritated this time, it all could be different this time than it was the last time. So we can't treat it exactly the same and expect to just get the same results. For some people, that works for a while, but I often find that when people have this sort of yo-yo effect of their back pain, especially when it comes back for the same reasons, they eventually get to a point where the stuff that's always worked just doesn't start to work anymore. Okay. So we need to treat it based on how it is presenting right now. Okay. The other reason why we can't treat them the same is just like what we talked about in number one, because not all of them are alike. You could have the exact same presentation of symptoms and have it be different structures. I've had people who have had nerve pain, radiating, let's say, down their leg from their back and their sciatica and their sciatic nerve area. And because they had a known disc herniation, okay, however many years ago, whatever it was. And they say, I think I have that again. And we test them and we do all the testing that would indicate to us in a physical exam that it's a disc and none of it hurts. And in fact, the stuff that points more toward what we call stenosis or some arthritic change in the spine. And then because there are areas of weakness around that area, put more stress on that place. It's not the arthritis alone that causes the pain. That'll be another episode. But anyways, it's a different structure, right? So it's responding completely different. So they have arthritis, so there's more stress on that area, that one area, because of imbalances of mobility and stability and strength, which puts more stress on that arthritic area, which puts more stress on the nerve. But it's the same nerve that was irritated when they had a disc issue. It's radiating down the same area in their leg. So I think it's the same thing, but it's not. And if you treat that like a disc, you are going to make that pain way worse and vice versa. Okay. So because they aren't alike, they cannot be treated the same. Okay. And then my final point here in this episode is that early intervention is key. We have a very unfortunate statistic, and there are way too many medical statistics out there, I feel, that just get taken as, well, that's just how it is, when that's not what the statistic is meant to tell us. Okay. That data is meant to tell us that there can be something done about this, or at least give us reason to explore whether or not something can be done about this. And in the case of back pain, there definitely can be something done about it. And we know that there is, but 80% of people who have back pain will have a recurrent episode of back pain. Okay. I think that number could be much smaller. Okay. Again, I think too many people in the medical community just say, well, you've had back pain before, you'll have it again. That is what it is. It's the natural part of life. No. Say it one more time. No. I am not okay with that. Sometimes it can't be avoided. There are things outside of our control, but if we control everything we can in those situations, it can be better. So the third point again is early intervention is crucial to make sure we don't become part of that 80% statistic. But if you are already part of that 80% statistic, and maybe it's become chronic for you, like pain has never fully gone away, and you feel like you've tried everything, chiropractors, acupuncturists, massage therapists, injections, physical therapy, all of it, don't give up. Okay. You don't have to live with back pain. All right. I'm looking right at you. You don't have to live with back pain. I'm going to say it really close into the mic here for the people listening. You don't have to live with back pain. Okay. It can be treated, whether it's acute or chronic. And if we treat it acutely, even if it's like starting to go away, right? I tend to tell people you don't necessarily need to run in and get an appointment within a day or two with us of your back pain starting, but kind of see how it goes for you. But if it gets better but doesn't completely go away within like a 5 to 7 day period, we should work on some things, right? And that plan's going to look a lot different than if you've been in pain for weeks to months, but it's still going to be a plan that is going to help prevent you from having that pain come back. Because in that time period, even just 5 to 7 days, you are going to develop different types of movement patterns to continue to get through your day that are going to feed into imbalances you might already have, that then make our body move differently, that then put different type of stressors on our body. And then later on down the road, something else happens in our life, something out of the blue, a big upscale in activity, a big downscale in activity, big swing in that pendulum, whatever that looks like. And all of a sudden those imbalances can't hold up to that stressor anymore. And that brings on a lot of our pain. Okay. So that, again, I don't know how many spin-off episodes we've come up with in this episode, but early intervention can make sure that you or help make sure, I'm not going to say make sure, there are no absolutes here in healthcare, but earlier intervention with acute back pain can help to make it possible for you not to become part of the 80% who have recurrent episodes of back pain. And if you are already that person and you would have what is called chronic or you have what is considered to be chronic back pain, there is still hope for you. Okay. There is still hope for you. And there are people out there that can help you. Please reach out to them. I'd be happy to be of any help I can, even if it's connecting you with someone who I think could be the best for you, even if it's not me. So those are the big things, some of the big myths here. No two episodes of back pain are alike. Okay. Even if they're from the same root cause, they're not always alike. Number two, because they're not always alike, no two episodes of back pain can be treated exactly the same. There are going to be differences. I've seen it many, many times. And number three, early intervention of back pain is key. But even if you've had back pain that is chronic, which means you've had it for 3 months or more at some level or another, and it's never like fully gone away from you, it is still possible to treat it conservatively without injections, medications, or surgeries. Okay. We can avoid going under the knife. We can avoid being in pain, and we don't need to take pharmaceuticals for that. So I hope you all found this educational. I would love to hear your comments. Would love to hear your questions. All my contact information is in the show notes here. You can look me up on social media. You can look the podcast up on social media. You can look WorkFitME up on social media. I would love it if you followed all of those places. We're putting helpful information out for people all the time in all of those places. So I would absolutely love it if we were hearing more from you all with questions, especially about this topic. So it can be confusing. I would love to answer things that are more specific and more tailored to you based on what you heard today. So don't be afraid to reach out. All that info is in the comments below. That's all I have for you this week. I hope you all have had a great week. Go make this next week a great week. And we've got more interviews. Like I said, pretty much from now right through the start of March, Got some fantastic interviews lined up for you. I'm so excited to talk to these people and share this stuff with you. Can't wait to see where all these fantastic interviews go. So go make it a great week, everybody. And we'll see you back here next time on the Strength for Your Purpose podcast. Bye now.